Oh, hi, Dr. Henry. There were 47 cases in 5 classes at a Surrey High School before the Christmas break, and the superintendent said they were linked to PE class, specifically the school gym and the weight room. Is it a good idea to have students, many of them unmasked, exerting themselves and exercising in an indoor space like a school gym? Doesn't this huge number of cases at Earl Marriott suggest we shouldn't be having PE classes right now, especially without a mask requirement?
Yeah, so I think what you bring up are a number of different things. One is what procedures were being followed in that class, in that school, whether all PE classes need to be modified, how they can be done safely. We know that it's really important, and that for some children, the physical aspect of school is important in terms of their learning. So there are ways it can be done safely. The fact that it's happened in one place means that we need to relook at how it is done and can be done safely. And you talk about masks. Masks are an important part of the safety procedures in schools, in all schools. However, we know that when you're exercising and physical exercise, when they get moist, they're not as effective. So I don't think that's the answer to PE classes, but I do think there are things that need to be put in place to make sure that if PE classes are being offered, they're offered safely.
Shannon, follow up?
Yeah, staying with the school theme, concerns are being raised that the latest modeling data only shows schools that have had exposures versus the number of exposure events. Some believe this minimizes the amount of transmission that's actually happening. So why is this the approach that's being taken? And are there discussions to provide more data on school exposures in the future?
Yes, obviously looking at additional data. I'm not sure I quite understand. So we do not all exposure events. All exposure events are reported. They're not. Most of them are not linked to transmission. But yeah, we're looking at that. Of course, we want to make sure. And our attempt at the very beginning was to be as open as possible, and that's why all exposure events were reported. As people have noted many times, it's a challenge because we often don't know about them until several days later, and sometimes parents, others are speculating, or they put out information that may not yet be known to the rest of the school community. So there's that challenge in understanding what information is being put out. So that is part of the work that the school response team that I've talked about a few times, Dr. Reka Gustafson, my Deputy Provincial Health Officer and the head of the BC CDC, I tasked her with taking that on along with Ministry of Education, BC CDC, the school health officers from the health authorities, and others, to make sure that we are looking at all of the safety plans. We're looking at those events and what can happen. And one of the things they absolutely are looking at is, what is the data that we have and what can we provide to people to meet those needs. And I will say it's a challenge because we don't collect some information that some people will like, and we can't share some information that some people would like.
Next question is from Marcella Bernardo, News 1130.
Happy New Year, Dr. Henry and Minister Dix. Again, I'm going to be keeping on with the school theme and airborne transmission, especially now in care homes and schools, which may have poor ventilation systems. The World Health Organization and the Public Health Agency of Canada have recognized that this can be spread by aerosols. So why, again, not make masks mandatory in schools?
Yeah, so I think those are not necessarily connected in the right way, Marcella. And we have also obviously recognized that there's a continuum, and I've said this many, many times, maybe not in the last few months, or in the last few weeks, but we've said this, there's a continuum of droplets, and they spread in many different ways. But how you get infected with this is inhaling droplets that contain live virus, enough virus that can infect you. And that's the vast majority of how people are infected. So we know that in some situations, it's more likely for those small droplets that have live virus in them to hang in the environment for longer or to be more risky. And those are the things that we have been talking about repeatedly. Closed environments with poor ventilation, when we're in close contact with people, speaking face to face, particularly if we're singing or talking loudly, where we have crowds of people, large numbers of people who are in close contact together. That's how we get super spreader events. So that the measures that we have in place in long-term care, the measures we have in place in schools, are to have layers of protection. So we're reducing the numbers of people, we're keeping distances. It doesn't necessarily need to be 2 meters, depending on what you're doing. It may need to be longer or wider than 2 meters. We've seen this with things like some of the high-intensity gym classes, where we know that you need to have more space between people, or we need physical barriers and we need ventilation. And I know there was another paper put out recently talking about the importance of ventilation, which is something we absolutely agree with, and that we've been working with the Ministry of Education to use some of the money that the federal government has had to put into looking at ventilation in schools. But that's only one of the pieces, and the challenge that we run into is there's no one thing that is going to make the difference. It's having all of those pieces in place in the right place, and then sticking with it. And that's been our challenge. We all know that we get complacent over time, or we forget, or we bend the rules a little bit, and that's what our focus needs to be, is staying with it.